Greetings. Welcome to A Crohn's Disease Life. I'm your host, Michael A. Weiss, and the topic for today is when you stump the doctors, what do you do? Now, for those of you who are unfamiliar with this video blog or podcast, I'm the host, Michael Weiss, and I'm 47, and I've had Crohn's disease, C-R-O-H-N''S, for about 25 years. It's a incurable autoimmune illness that primarily affects the digestive tract. And as a result, I've been hospitalized now almost 200 times. I've had about 15, 16, 17 major surgeries, and I wouldn't be sitting here or be enjoying life if it wasn't for the support of my family and friends. I actually wrote a book about it called Confessions of a Professional Hospital Patient. The book is I've been told, is a very funny but respectful account of what it's like to live with a chronic illness, both inside and outside the hospital. And patients read it, families of patients read it, and they get a lot out of it, and they get a different perspective. And it's a perspective that has helped me cope all these years. So you can check it out online at Amazon, Barnes & Noble, or on my site, which is hospitalpatient.com. Today's topic: when you stump the doctors. Now, what do I mean by that? Let's say you have severe back pain. You go to your doctor and, they sort of have these different stages that they have to treat you at: physical therapy, then an MRI or an x-ray. And let's say you have all the tests done, and they say to you, listen, Michael, I know that you're in pain, but there's nothing wrong. What do you do? I mean, people have this happen to them in every part of their body, whether it's pain, whether it's discolored urine, whether it's being very lethargic, etc. And sometimes they uncover very serious things. But let me tell you a story what happened to me with back pain, because this is sort of how I know about this, and this is what I did. I had that exact scenario about, I would say, 10 years ago. Back pain, the whole thing. And I had an MRI, it was normal, but I was in so much pain that I was literally living at the pain management doctor's office, on really serious drugs. And I was at the point where I was like, if they can't figure this out, then I can't live like this. Besides the pain, I felt like I was like a burden on people who were helping me, and I didn't want to be someone who lives life that way. So but I kept pursuing, because my main recommendation here is trust your body. You know your body better than anyone else, and if you have such severe pain, there's got to be something wrong. So as much as the doctors told me the MRI is negative, there's nothing wrong, the logical side of me kept saying, wait a second, if I'm taking morphine, unless I'm a drug addict, and I don't think I am, because I was seeing a pain management doctor, why would I need all this medication? I mean, I couldn't get out of bed. So what I did was, I sort of looked at it as sort of like a germ diagnosis, which is what I recommend you do, because it could be very frustrating, as it was with me. And somewhere along the way, I got recommended to a doctor called a physiatrist. I had never heard of that specialty. And I told him all of my problems, and he said, I have an idea. We're going to give you a test called a discogram, which is an antiquated test which an MRI has replaced. But let me see what we could find out. And really what the test was they put me down in a fluoroscopy suite, and under fluoroscopy they injected my discs in my back with saline. A healthy disc would hold the saline, and an unhealthy disc would not. Well, and then they would take pictures of it. In my case, my disc just blew all over the place, the saline. I had a ruptured disc, but it was so severe that they weren't sure if I had one or two ruptured discs. So it was very frustrating, and my insurance company at the time, and this is another aspect of it, because if doctors say there's nothing wrong with you, any additional test, a lot of times your insurance company will say, wait a second, your MRI was negative, there's no way we're covering these other tests. Well, at the time, my insurance company had that exact position. If your MRI is negative, I don't care what the discogram says, we're not paying for it. Here I needed a second discogram, and they cost a lot of money. So I had the second test, and it revealed that I had one ruptured disc, and I was a clear candidate for surgery. And then I went and saw a bunch of surgeons, and they all agreed, although I got very different opinions, different percentages of how good I'd be after the surgery. I picked a wonderful surgeon, and I'm okay. Now keep in mind, my insurance company would not even pay for the surgery, because it was like, In the legal profession, we call it fruit of the poisonous tree. It was a result of tests, the discogram, that they didn't want to pay for. So therefore the surgery was unnecessary in their mind. So I begged the doctors to work with me, give me a year. I needed to recover. And then as an attorney and as a patient advocate, I was going to fight my health insurer and using their appeals process. And that's exactly what I did. It's actually detailed in my book. All the letters, they're redacted, of course, to preserve the anonymity of all the people involved. But I won. They reimbursed the cost of the discogram, they paid for the surgery, and I also got attorney's fees. So the main thing is trust your body, okay? And then moving forward, you have to look at it as a journey. And keep in mind that there's going to be a lot of people, your loved ones, your parents, your girlfriend, your wife, your husband. After a while, they're going to say, honey, I love you, but you know what? Maybe there's nothing wrong with you. That's probably the most difficult thing to deal with, I have found. Because you understand their perspective, but obviously you want them to support you. And that's a very difficult thing to manage. So what you have to do is don't condemn them for it. Understand that they're trying to help you, they're trying to be logical. And a good way of sort of doing this is, and I had another situation where I had some problem and no one could figure it out, and my gastroenterologist said, I think you need to see a psychologist, sort of implying that it was up in my head. I knew it wasn't, but I knew that if I went and saw the psychologist, I was at least doing what they said, because I knew that I was going to prove them wrong. So whatever the naysayers say, just follow that. But concurrently, go down your journey diagnosis. And what I mean by that is get referrals, ask doctors, do research, okay? But when you go see a new doctor, have low expectations and plenty of patience, because you could have let's face it, if many doctors before the doctor thought there was nothing wrong with you, the other doctor is not going to find anything wrong with you. Now, if you keep going and keep going, you will eventually find out what's wrong. And be confident, because if you trust your body and there's pain or these other irregularities, there is something wrong with you. You just haven't met the right doctor. Now, in my case, I met that physiatrist and it changed my life. But it taught me a valuable lesson, because living with Crohn's disease, I often have very strange side effects or problems, and when doctors come in and say, we did an MRI, we did this, we didn't see it, I listen, but I don't care. I'm like, well, I'm sorry, but please find out what's wrong with me. I mean, I'm respectful about it, and I think you have to take the same tone. And I think patience is the one thing. I mean, the loved ones not supporting you is very difficult, but that's understandable, and you have to deal with that because they love you, they're trying to help you. But patience is something that you're going to run out of, and you can't. You have to look at this, like I said, it's the journey to diagnosis, okay? So every time you're at a doctor's office, bring books, listen to podcasts, try to accomplish things that you wouldn't otherwise have the opportunity to. Look at this as an opportunity to have idle time, okay? But always be pursuing what's wrong with you. And lastly, what I want to say is the internet can be a great source of information, and it's a great way to do research, but be very careful in listening to patients, whether good or bad, because typically the patients who write about their illnesses, and I guess I'm one of them, so I guess I'm condemning myself, but be careful, because people who go to the lengths to write a long comment online, they could have a personality conflict with a doctor. Like, there could be other variables that you don't know, so be careful. I mean, take the information, take it with a grain of salt. Every information that you may get on the web, because you don't know from whence it comes. I mean, in my case, I wrote a book for the world to see, so I'm not hiding anything, and I'd like to think that everything I say is truthful, and I'm sort of pouring my heart out for the world to see. So I don't have anything to hide, but the people who hide behind anonymity and tell you all about their experiences, be careful of those. So in closing, trust your body, have patience. Your loved ones, try to understand that they're not naysayers. They love you. It's just a logical approach, and they will come around. So just be persistent, have patience, and just look at it as a journey. So thanks for watching and listening or subscribing. And if you have any questions, you could always contact me at michaelweiss@hospitalpatient.com. you could go to the website, hospitalpatient.com, and check out the book. And on Twitter, you could follow me. My name on Twitter is Hospital Patient. Thank you.